Good morning, Lake Providence Church family. This is Dr. Linda Plummer Ward with another health ministry update. Yesterday, we were blessed to present our first LPMBC health ministry mini-series, and it was on mental health with Deacon Ed McKinney and Dr. Kenya Newby. They did a wonderful job. The recorded teleconference is on our Facebook page at LPMBC Nashville Health. That's LPMBC Nashville Health on Facebook. Check it out. We hope you'll be able to join us every fourth Saturday at 10 a.m. on Facebook Live for future editions. You're welcome to submit questions to our website prior to the event or on Facebook Live. Okay, so this week we're going to talk to the youth and the young adults. And I'd like to start off with questions. Do you believe that you can get COVID-19 or the Rona, as some people call it? Or are you thinking that it'll be like the flu if you were to get it? Most young people with COVID-19 do not get the severe form of the illness requiring hospitalization, but they can get pretty sick. This is not the same as seasonal flu. It spreads much more easily. Its symptoms vary from one person to the other, and the severity of the illness varies from one person to the other. There is no way to determine at this time who will be the one to get just a few symptoms and mild disease, or who will get severely ill or might not even survive. It infects the body through the respiratory tract, as you probably already know, but it can cause also severe damage and dysfunction to other organs in the body. Let me ask another question. Do you wear a mask and practice social distancing? Mind you, I said and. It's not an either or. They go together. So you practice wearing a mask and you practice social distancing together. The mask protects you from me. Social distancing protects me from you. So, currently, most of the new infections are in younger people. This is our largest group of vectors right now. What's a vector? Well, I'm glad you asked. A vector is a living carrier of a germ, in this case, the coronavirus, that can spread to and infect other hosts. The mosquito, for example, is the vector of malaria and West Nile virus. The tick is the vector for Lyme disease and other tick-borne diseases. But what's the vector for COVID-19? You guessed it. It's humans. It's us. We are the vector. Why are we such good vectors? Well, the virus spreads easily from one respiratory tract of a human to another with a cough, a sneeze, and some studies even say with speaking. There are so many of us to keep the virus moving, it just loves us. We tend to get together in groups. It likes that too. We are social beings that benefit from hugging and touching. That's perfect for the virus. We may be infected with no symptoms and spread the disease even without knowing it. We also resist compliance. In other words, we're not, in general, doing all that we can to slow the spread of the disease. Namely, washing our hands frequently, wearing masks, and practicing social distancing. Now, how do we even know this helps? Well, because other countries who've battled COVID-19 found it to be effective. And in the control of diseases in years past, it's been effective. So this practice to slow the disease, to slow the spread of the disease, is evidence-based. Even though youth and young adults are less likely to suffer severe physical illness or death, this global pandemic will have lasting social and economic effects in the years to come. So even if you don't get the infection, this definitely will affect you now and possibly in the future. Slowing the spread is extremely important. It's for all of us, and that includes you. What can I do to slow the spread? If you're sick, stay at home, quarantine, wash your hands frequently for 20 seconds with soap and water. If no soap and water, use hand sanitizer. Cover your cough and your sneeze with tissue, throw the tissue away, wash your hands. Wear a mask and social distancing. How can I protect my body? What can I do? Well, first of all, don't allow yourself to be in an environment where wearing a mask and social distancing is not a practice. So, eat healthy, sleep well, exercise, spend time outdoors when you can. If you have symptoms, you need to stay home, treat the symptoms, get tested, and quarantine yourself. And what are those symptoms again? Because that list has grown considerably. It's fever, cough, congestion, trouble breathing, chest pain. Now it includes chills, new loss of taste or smell, headaches, sore throat, nausea, vomiting, diarrhea, fatigue, and muscle or body aches. How can I address this stress? Well, first thing is stay connected via phone calls, emails, video chat, social media, text messages, cards, letters, whatever you would like. Just stay connected. Monitor overuse of food, alcohol, drugs. Limit your negative images and stories in the news, and oh my gosh, give the phone and the TV a rest. Meditate, get enough sleep, and be intentional about positive thoughts and information. Be flexible. What can I do for my spirit? Stay in God's Word and listen for His voice. As Deacon McKinney said yesterday, seek peace. Make time to meditate and pray. Maintain an attitude of gratitude and bless someone else. Look to your parents and those you trust for guidance, support, and reassurance. Now, if you start feeling excessive worry or sadness or hopelessness, or you feel like you're having behavioral changes such as unhealthy eating or sleeping or difficulty concentrating or paying attention, you need to talk to your parents. You may need to have a counselor. And if you need to see a counselor, that's okay. Just make sure you talk to somebody. This is a very special time to be a youth or young adult. We have experienced almost a worldwide shutdown, and we must find new ways to do things in what is expected to be a new normal. So in the midst of fear, anxiety, and uncertainty, there is an opportunity for leadership in invention and innovation. And I know you got it in you. In the meantime, stay informed. We recommend the resources that we use for COVID-19. They include the World Health Organization website, the Centers for Disease Control and Prevention website, the Tennessee Department of Health website, the Nashville.gov website, WebMD, and the LPMBC Nashville Health page on the church website and on social media. Right now we're on Facebook, but soon to come on a few others. Be safe, be healthy, and stay prayed up. Thank you for watching.